I'm Simon Smale. I'm a gastroenterologist. I work mainly at Manchester Royal Infirmary, which is part of the Manchester University's Foundation Trust here in the north of England. So I became a doctor because it seemed like a good idea at the time. I think that I had an interest in science. I had an interest in helping people and wanting to kind of serve the community that I live in. And I guess I became a gastroenterologist because it had an interesting mix of uh, young patients, older patients, some palliative care, which appealed to me, and also some long-term care, which also appealed to me. Okay, so I guess I became a gastroenterologist because I was interested in patients with long-term conditions, but also some conditions which are acute. But also, it covers a broad range of age groups. There are patients who are young, who have chronic disease, where you can make a real difference to their quality of lives going forward. But there are also patients who have disease at the end of their lives for whom you're making a qualitative difference in terms of the palliative care and those kind of things. So it's an interesting and broad ranging subject. So I think the best bits of my job are making significant difference to some of the pivotal moments in people's lives. Uh, I think if I were to distill those bits, the highs I get are from emails where people have seen a number of individuals, perhaps across the country. They come to see me, and we spend a bit of time sorting them out. And those emails where people say, I've been like this for 20 years and you've made me feel better are fantastic. They get me up in the morning. So I think what patients value most in me is probably the fact that I try and give them enough information, as much information as I can, and involve them in the decision-making process. I see it. The best healthcare is delivered in teams, and that central to those teams are patients. So patients, for me, should be more and more involved in their care. Uh, and more involved in the delivery of the outcome for them, really, because it is ultimately they're the focus of what we are doing and what they're wanting. In terms of, I guess that's what they value in me. What do I value in them? I think I quite like patients who ask questions. Um, I quite like spending time with patients. One of the nice things about private practice is I get to spend a bit more time with people. I think the motto of the Royal College of Physicians is a good one. So I think primum non nocere, it's in Latin. I translate it into English and it basically means first do no harm. I think historically physicians have sometimes done things because we can, not always because we should, or because necessarily it's the thing which holistically delivers best possible outcomes for the patient. And I think sometimes there's a temptation for us because we can to do more and more stuff. And sometimes we just need to explain what we understand, what we don't understand, and not intervene where intervention poses a risk of harm.